was a great question, so I wanted to answer it here for everybody. So it's pretty much about getting end range of motion. So sometimes people have these injuries, whether they had surgery or they didn't have surgery, whether it's in their hands or in their wrist, they can have a lot of scarring. They can even come to you months or years later, and they want to know, is the scarring the main contributor to their lack of end of range motion? A lot of patients ask us, will they ever be able to make a fist? Will they ever be able to, put weight through their wrists again? That kind of stuff. We have a case where this kid that I have, he's got a finger fracture here, P1 fracture, and a lot of scarring. It's a twofold type of question. So first you have to think, is it a bone? Right? Is it a bone type of issue or a soft tissue type of issue, right? And it could be, and most likely in most cases, both types of problems. So I always feel and think that people have a lot of potential to get a lot of their recovery back, no matter how long it's been. It's about setting the standard or setting the stage for how much they're going to be able to get back. Some injuries you just can't get back, and that determines your answer or your confidence in terms of how you feel, right? So for example, the kid that I have with a P1 fracture, he's got a fracture right here, right? He had a fracture right here, and it split his skin. So his circumferential swelling, and he is real tight right here. So what you're looking for, right, is when we extend our fingers, you need to look at the dynamic of that hand. His small fingers have a tendency to do this. It doesn't necessarily mean it's a nerve issue, but if you lack motion here, you might become real loosey-goosey right here, and someone who lacks motion, they might go into hyperextension of the small finger, which then promotes flexion of here. So can I potentially get, full range of motion with him? Absolutely. If your joint, right, if your bones were fixed the way they could be fixed, meaning if they got broken and the doctor was able to realign that bone and it's sitting straight, right, we have every possible chance to get full motion back. So he's got the absolute best chance of getting that motion back because your doctor put your bones back together, your joint looks in line, so we have every possible chance of getting that finger back, right? Because the bone is in line, the joint is in line, and now the reason why we haven't gotten it back is because what? Soft tissue potentially. If you move too much here in your MP, your big knuckle, and it's causing you to bend here, and that tendon that you cut, that the surgery is all stuck on the side, well, it's making it hard for you to really keep extending, making this knuckle straight. So sometimes what we have to do is we have to keep stretching that one knuckle. And it's like so hard because as therapists, we think that we need to do fancy things and we need to do tons of activities, when it's so simple as just getting that knuckle straight. I put all my attention to stretching the shit out of that knuckle. It's gonna get straight, and then after it gets straight, I need to move those tissues to make sure that it moves better. So I literally just sit here and work on extension. I grab that skin, I move that skin in every which way, and I just work on end range extension. I've got to block him here so I can move him here. So his possibility of getting it is, of course you can get it, right? Of course you can get it. What's gonna stop you from getting it is because the natural movement of your hand wants to not get it, right? So the natural movement, when you move your knuckle, goes backwards like this, and then it bends down like this, and you're not doing anything to stop it, then it's gonna take a lot longer because you're not doing, I mean, we are only in therapy for twice a week, 3 times a week. That's 2 hours, 3 hours of time together. I need you, said patient, to do a lot more. So is it absolutely possible? Yes, it is. Does it matter how long? Not necessarily, right? Do you have the possibility? Absolutely. We can move the joints, we can move the soft tissue, and you can get even better motion. 100%, I never go to 100% unless I really do feel that the joints are moving well, but I do anticipate that the certain tendons are damaged so much it's really hard to get it. In this particular case, in Arturo's case, where we talked about getting end range of motion for him, it's totally possible to get it. Will he get it because he needs to do it on his own? That's on him, right? Now, you might have people who come to you with injuries from a long time ago. I actually had a wrist case. He came into me, had 3 scaphoid surgeries. I saw him for one of them. He came back to me 10 years later, complaining of the scar hurting, right? Is it possible to get him better movement? Well, I don't know about better movement because that particular type of injury, you might not want to get better motion because of that particular bone. The scaphoid bone is very hard to heal. He had multiple types of procedures to help that bone heal because it was a non-union. So we actually don't want to get too much motion if it's going to cause him more pain. But can you get better? Can you still affect the scar? Absolutely. Scars take 1 to 2 years to really mature. So that means with scars, it can still move, it can still realign basically. It matures very slowly over a long period of time. Your first 6 months is your most opportune time to make changes, but when people come back to me years later, of course you can still make changes. It's not so much that it's the scar now that's the problem, but the fascia underneath everything that is imbalanced, right? So if I've talked about it before, I've talked about it a million times before. Soft tissue. What is included with soft tissues? If you want to go deep down, you're talking about ligaments, you're talking about capsules, you're talking about tendons and muscles. Right? And then you're talking about fascia. In wrist particular cases, like ligaments and stuff, it becomes a little bit more like I need to know my ligaments. I need to know what's going on with the bones and the ligaments that hold it. And then the capsules that hold the joints and bones together. And then I have to look at tendon muscles, and I have to look at fascia. So sometimes people come into you and they want to know what's possible. Well, it's possible to a certain percentage to reduce the tightness and the aches and pains. It's possible to make changes to all of those tissues, right? Now, how possible it is depends on them and how much time and effort they're willing to put towards it, right? If everything looks good, like the bone is aligned, the joints are aligned, then the key thing is, like, when you get them pretty early, I always tell them, even if they don't stay in therapy to get to 100%, because let's say, for example, you have a distal radius fracture, right? A distal radius fracture heals by 3 months, right? So by 3 months, 12 weeks, you're allowed to do full weight bearing. You shouldn't have any problems, but majority of the time, people don't get to 100% full motion at that time. And so what happens is they'll end their therapy and they'll have a residual, right? So if I get you to about 80 to 90% in therapy, you now are asking that person to get 20 or 10% on their own, right? Once you start getting to about 80 to 90%, people start not having it all the time. It's not consistently painful. They're functional. They can do everything. So they're going to ignore that 20 or 10% that they could potentially have. And so the key thing in talking to your patients is, listen, I know you might not stay with me until you're 100% because that takes a long time, right? I know you might not stay with me until you're 100%, but I need you to keep stretching. I need you to keep doing your exercises. Even though you're going to do them less, you need to keep stretching until you no longer feel that tightness. People tend to start to lose what they've gained in small increments because they never got to that full end range. But is it totally possible? It is totally possible for you to not have that stiffness anymore after a distal radius fracture. And those people who tend to tell you, oh, I've never 100% fully recovered, they never got to that end range of motion. Now, that end range of motion might not be perfect. I'm not asking for perfection in motion. Some people's injuries are so bad that Humpty Dumpty, when he fell, all the king's men couldn't put him exactly back together again. But what happens is you can still get rid of that stiffness as long as you continue to stretch and stretch until you no longer feel that tightness. And that's what you want to tell your patients. You can continue to stretch and stretch and stretch. Obviously, the right stretch with the right changes in how you're stretching will give you that sensation of no longer feeling tight, right? So there's a lot of different components to look at. And so when someone comes to you at the end of the day, and it's been a while, and you can say it's absolutely possible. How possible it is based on, when you come in and we make small minor changes to how you're stretching, to how you're strengthening, to how you're moving, right? So some fingers, they're so badly injured that they cannot get full motion, right? But that sensation of tightness and of stiffness, and can we get that away? Absolutely, because then that's soft tissue. Like, how much of it is tendon, muscle, and how much of it is kind of like the skin and fascia, right? Oh, skin, I forgot that. How they move over a certain period of time. Well, we have absolutely every ability to be able to affect and change it. You just have to pre-frame and reset your patient's idea of what they want, right? Their idea might be that it needs to be perfect. Well, let me understand what your perfect means. Let me understand what your 100% means, because I will reset that and say, okay, if I have a patient whose injury, her bone is angled, right? So because her bone is angled, she's never going to get full motion, right? It's just never going to get full motion because, listen, your bones, when they reset in an angle. And once they're reset like that, no amount of therapy is going to make that bone straight. What we can do in therapy is reduce the chances of things getting worse and you developing different contractures because of that angulation. Now, what we can do in therapy is going to get you the most possible straightness of your knuckle, most possible bending of your big knuckles, and to reduce any kind of pain. But there's a certain amount that you're going to have to keep doing for as long as you keep feeling tightness, right? So you've got to reset that. You've got to say it over and over. When is this ever going to go away? Well, the way your fingers are bent, that is the way they're bent. How much straightness or how much flexion you're going to get to make a fist, that's what it is. But here I'm going to be teaching you the strategies in which, I'm going to teach you the program in which you want to keep doing so that you can reduce the problems that you're going to get, and the pain that will come, or the stiffness that you're going to keep stretching until one day you don't have that stiffness anymore. And for some people it will be forever, and for some people they'll just do it every once in a while. It'll last for like a year and they'll get going. And those people who have chronic types of issues, if you do a really great job with them, you invite them to come back to you time and time again to get relief. I have a patient who follows me every year for the last 10 years, and her hands are, were damaged beyond repair, right? Beyond repair. I cannot get her more motion. I cannot get her, I cannot get rid of all of her pain. But what she comes in for is an incremental change in how she feels. So if she can just feel 25% better, and she feels like as if I've opened up her hand, right? And she feels as if they're looser, longer, or they're looser. She doesn't have to push as hard, and they'll stay looser longer. These are those incremental changes that we can make in someone's lives. It doesn't have to be 100%, but I've been able to help her understand that what I do in therapy is incrementally going to improve her just a certain amount, so she can feel more comfortable in her hands, so she can feel like she has more strength. And actually, even though I don't change her motion, what I do change is her strength, because when you feel really tight and you feel really painful, you're not strong. You don't feel strong, so you don't give it that grip and that power. If I can help her feel loose, and I can help her ease her pain, when I do test her grip strength, it's increased a certain amount. Now, I'm not looking for perfection. Again, I'm just looking for an incremental change in her grip strength, so that she can feel like she can cook. And one of the biggest things for her bilateral hand injury is to be able to put her earrings on. And when she can't put her earrings on is when she comes back to me. When she's cooking and she feels like she can't hold to stir stews and soups and pasta and stuff like that, she comes back to me. So patients have every ability to continue to make progress over a long period of time. And I want you to open your mind to think about how patients can keep coming back to you time and time again. And it doesn't have to be this one-time wham bam thank you ma'am type of deal when it comes to therapy. People can come to you, they can come to you for a period of time, and then can take a break, do stuff on their own, whatever, and then you can invite them to come back to you when they start to feel worse. And that has absolutely nothing to do with you and everything to do with them, right? We have got to stop assuming people can do that 20 to 10%, because when you're not in a ton of pain, you might not want to do it. But when they start to feel it more and they start to notice like, oh, like I can't do certain things, let them know. Again, it goes back to anticipating. Let them know when they start having a little bit more pain, or when they start feeling like they can't do certain things, that you should be the first person that they call so you can help them bridge that gap, right? I personally think anything is possible, no matter how long the injury has been, to help people get rid of their pain and allow them to be more active. And that's just my take on it.